So I'm going to demonstrate pendulum exercises. This is typically done after a rotator cuff repair. So we went over this, how to use the sling, how to take it off safely. You lean to the side, you're going to slide the sling off, and then you can stand back up. Now pendulums are used to get some motion in the shoulder without putting pressure on the rotator cuff. So what you'll do is you can take your hand and put it on a table or something firm to balance, and you're going to lean forward at the waist, spread your legs wide, and let your arm hang like it's just a limp noodle. And you're going to use your body to let the arm do some little 1 foot wide diameter circles like that. You're not doing this. That's using your rotator cuff. You're letting your arm hang limp, and you're using your lower body to let it do some circles like that. Clockwise, 20 of them. Counterclockwise, 20. You can turn your palm facing forward and do the same thing, and you'll feel a little different stretch. But I'm not using my arm. I'm letting my arm hang like it's dead, and I'm just letting it do some little circles. You might start out early on after surgery and just be able to bend over a little, but your goal is when you come to my office to be able to bend like you're bending your knees, your hand is almost to the ground, and you're letting the arm hang at 90 degrees to your body doing the circles. So those are pendulums. Then you'll bend your arm back up, tilt to the side, slide the sling back on, do all the straps, and be back in position. So in addition to your shoulder pendulum exercises, it's important also to get your elbow moving. Whether I allow you to actively bend your elbow or whether the elbow has to be moved using the other arm will be based on whether your biceps was reattached in a new place, or tenodiced, which is the name we use for that. So quickly to go through things, you take off your sling, like we discussed. You lean forward, slide that off so gravity is keeping the arm away from the body, not your arm, and you stand up. If you did not have your biceps tenodiced, you can actively bend and straighten your elbow without disrupting the rotator cuff repair. I want you to do this. I want that elbow totally straight because your elbow will want to get stiff. Now, if you had a biceps tenodesis, you'll take your sling off, let your arm hang. You can lean forward, use your good arm to bend the elbow up and down, and do 3 sets of 10 or 15 of those 2 or 3 times a day. So you are not using your biceps muscle because that got reattached and needs to heal in, and we don't want it to stretch out. So the elbow motion, either actively if nothing was done with your biceps, or passively with your other arm if your biceps was reattached. And that will be no active bending of the elbow for 6 weeks on your own using your own muscle if the biceps was reattached.